In the sleepy villages of Siongiroi in Chepalungu, Bomet County, we find Helen Rono busy doing her household chores. She walks a stone throw away from her house to the edge of the farm to fetch water in this water pan, which her sons helped to dig more than 10 years ago. This has been her source of water for her daily use, save for extreme dry seasons when the pan dries up. These birds nest above the water pan, probably to be a partaker of this precious commodity. Being stagnant water, it is not safe for drinking as it is. Rono has a way of fixing the problem. She puts her water in this filter container from Nazava with a capacity of filtering 16 liters of water at a go, which is enough for our family.
We've been having a problem for a long time because where we get drinking water and for any other use in the house, we've been taking water from a dam down there, which is just stagnant. It is not good for human consumption, so any other animal can get into it, drink from it, and we've been consuming that water. It has been bringing a lot of health issues like headache, typhoid and diarrhea for a long time.
Her son says that it was tough growing up as they always had to drink unsafe water, which saw them grapple with waterborne diseases.
Hapo nyuma tumekuwa tukikunywa vile iko. So wakati wa kiangazi kuna bia malaria, kama bole, kuna magonjwa kama kipindupindu. Na bia unajua huko mahali tunaishi kuna msimu wa kiangazi. Na kama kijana kama familia, kwa sababu hatuna njia nyingine ya kuokota hiyo maji ama kupata maji, huwa tunategemea vile iko.
After such a long struggle, we were able to join Juhudi Kilimo Company as a group, and they were able to train us on the water filter, and we were able to acquire it through a loan. I've been using the water filter for 3 years now.
Santi, habari ya huku? I got to taste the water.
Well, my name is Tabitha.
Rono's daughter-in-law, who lives a distance away, makes 3 trips every week to borrow water from her mother-in-law before she buys her own water filter container.
My home is 5 kilometers away from here, and I normally come 3 times in a week to borrow the same water from my mother. It's been 3 months borrowing water from my mom, and then now we've been safe. My family members are now safe. I've never had any complaint from the members.
This filter container can filter any type of water without a problem for 3 years. From the home of Rono's neighbor Gladys Chelangat, who uses the same water pan for her water, smoke billows from the kitchen.
Saa zingine nakunywa bure. Kama kuni aisha. Saa zingine naenda hospitali sababu ya tumbo na kichwa.
Chelangat boils her drinking water occasionally. She says she hasn't been able to purchase the water filter container due to her economic status. Gladys confirmed that the smoke pollution from the firewood she uses to boil water and cooking has had a negative impact on her health.
So kiana daktari anawaambia nini?
Naambia enda uchamusha maji.
At Kapsiongo village in Sotik, women and men gather here to learn how they can address safe drinking water challenges they are facing. Due to the cost of acquiring a water filter equipment, and the economic challenges this community faces, they can purchase the equipment and pay in installments for at least 1 year.
The challenges women face in reaching out or providing clean water to their families is immense. We are also cognizant of the fact that climate change is a great impact to our nation and the world at large.
Through Judy Kilimo, members are able to get a loan to purchase the water filtering equipment, giving them an easy payback plan and at the same time enjoying safe drinking water.
Judy Kilimo is a microfinance that works with smallholder farmers and micro-entrepreneurs to provide them with transformative financial solutions across Kenya.
This community, just like many other communities across the country, has had to grapple with waterborne diseases for lack of safe drinking water.
Globally, 4.4 billion people do not have access to treated water in their house. And in Kenya, each year, 33,000 people die of diarrhea. And this health crisis is caused by the lack of safe drinking water. Besides people dying of diarrhea, in Kenya, 2.2 million children are stunted. This equals 26% of the children under 5. Yeah? And being stunted, it means that those children are not growing as fast as their peers, their body weight is too low, and eventually being stunted also affects their brains.
At Siongiroi Community Health Facility, Anyole, the nurse in charge, confirmed that the facility receives cases of waterborne diseases almost on a daily basis.
In this facility we have got some cases, very many cases of gastrointestinal cases, like diarrheal cases. So on TCR alone, we have seen a lot of cases of diarrhea. That's about 56 cases of diarrhea in January. February, we have got 54 cases. And then we have got typhoid cases. We have got 1 case on January. And then January Pia, we have got 68 cases of amoebiasis and 98 cases of amoebiasis. So those are the cases that we have had, which are water-related cases. And the reason could be, in this our community, we have got poor water treatment by the community.
The number of households without functioning toilets in this board paints a grim picture of sanitation in Siongiroi ward. According to Nyolei, many cases are recorded during the rain season.
This number of households, it is quite a high number. So, and you know, I told you that the water which we are using mostly is the one that are running off the ground. After raining, they run to the wells that we have dug. So, if they are not using latrines, so there is a high chance of that water being contaminated by the feces.
Most of these water sources are heavily polluted with E. coli bacteria. So with our water filter, we now empower households to purify their well water, their tap water, their river water or their rainwater, any water source. And we see that the people here, especially in the rural areas, they're really in need of a solution so they can have safe drinking water every day.
With 2.2 billion people without access to safe water, World Water Day raises awareness and inspires action to tackle the water and sanitation crisis. In Kenya, more than 28 million Kenyans lack access to safe drinking water, with over 41 million not able to access improved sanitation. Environmentalists are calling for concerted efforts with regards to environment conservation and water sources to save Mother Nature and the future generations.
If we do not partner, if we do not work together, if we do not support activities which ensures that we can reclaim some of the losses we've seen in the last 30, 40, 50 years, then I guarantee you, within the next 10 years, you'll be drinking soil.
To minimize deaths occasioned by lack of safe water, the national and county governments can embrace technologies such as water filtering equipment to fix the situation, among other interventions. Thank you so much. Dan Kaburu, K24, in Bomet County.